Hello everyone, my name is Kayla Marcoulier and I'm a student at Gonzaga. I'm in the Family Nurse Practitioner program. I debated doing this video down in the barn where you could see and get the feeling really behind my values and beliefs of working hard. But to be honest, the noise of cows mooing, sheep going, all of the ruckus was too busy and too noisy of a background. But I will share with you, I have one little baby chick that are pretty cute. So that's kind of what we have right here. But hopefully that won't be too distracting. I grew up learning it's okay to make mistakes and learn from them, but always telling the truth, respecting others, and doing what is right. Now, working as a nurse for about 10 years, those personal beliefs are known as nursing ethics. I feel every individual deserves kindness. Healthcare daily is making decisions for other people's lives. As a nurse, I strive to have patients have full autonomy and be a patient advocate. I like a holistic approach when helping others, really looking at the whole person, including body, mind, and taking into factors like social determinants of health, right? How does that play a factor in healing for these patients? As a nurse, I often say, if this patient was my grandpa, how would I want them cared for? I think that's really important to really look at a patient beyond the diagnosis or the patient in rooms 8, right? Those patients once, or are still somebody's, son, father, partner. They have, lived a life. And I think all that needs to really be considered and respected, and not just the diagnosis and the treatment plan. I often triage patients, giving them autonomy in their plan of care. As a nurse, it's my job to provide education to allow patients the freedom to make informed consents. Often in triage, we need to have veracity, which means telling the truth to patients. Some procedures are going to be a little painful, right? Removing an old dressing so we can make a clear assessment on what is needed. The fact of our wait times, that's a hard truth to sometimes be able to explain to patients, and how that works as far as acuity. Why do patients get pulled back in front of them? Those are hard conversations to have, but they are needed, and we also need to be honest regarding that, because patients have the freedom to decide whether they want to stay and receive care at our institute, or do they want to seek care at a different place within the community. Justice is another topic that comes up in triage often, because we need to take in consideration of patients equally. We need to give them the same level of care, respect, all of those things. Sometimes it's a little harder to distinguish, right, between the patients that's yelling and angry compared to maybe a child that has an ear infection, and you take your own personal experiences. Like, my son has had multiple ear surgeries, right? So those kind of tug at my heartstrings a little bit more to be able to pull that patient maybe ahead of a different patient, and that's not necessarily what needs to happen. So I really have to think about, okay, we have acuity, we have all these things, and every patient, depending on, requires the same level. I also have a strong desire to individualize care to each patient. So not just having a smart phrase with education bullets, but shared decision making with patients to reach their individual goals. I look forward to watching all of your videos, learning from you, and thanks for watching.